Burnout in healthcare workers systemic, and this was the case even pre-pandemic. So imagine now, 2+ years in, seeing your peers in tears and switching careers on mass. Need a fast solution. ICU bed shortage, even scarcer than humans trained to operate them. And in the face of lots of patients, clear we need to stop this migration of healthcare professionals, precipitated primarily by excess stress plus all the polarization we see presently in society, ramping up anxieties amongst even the most steadfast of us. So how do we reverse this trend fast enough? Compassion's what's needed to combat this, plus resilience, but these traits take practice, plus training. But thankfully, the Altruism and Medicine Institute's handily taking the lead. Doing justice, how? Beat the chorus, then we'll discuss.
Check the MO of the AIMI. Heard the SOS from some stressed gals and guys. HCW heroes, feeling burnt out. MDs, EMTs, RNs, no doubt. Dr. Barry Curzon heeded the call. Formed the Altruism and Medicine Institute, y'all, to prevent said burnout by building resilience, by unblocking the compassion already within us.
Compassion, the backbone to resilience, which in turn prevents the burnout we're dealing with within the healthcare system. Which then leads to the $1,000,000 question, said compassion. How do we generate it? We don't. The not so obvious answer to that interrogation. Confused? Don't be. Let me clarify. This compassion already there inside. It's just a matter of unblocking the obstacles to it, but easier said than done. So how do we do it? Well, the AIMI team says with emotional hygiene. But what does that mean? Namely, noticing then shifting our negative emotions and thinking to the more positive, healthy opposites. So for example, anger, if you've got lots of it, well, let's flip it to tolerance and patience. But hard to do so when we're already enraged, hence it's key to use mindfulness to see our pre-anger signs, like lack of sleep, heartbeat pounding, maybe irritability, tension in our neck, perhaps sweating excessively. Then once we've noticed these telltale signs, let's imagine them as a cloud in our mind. Then let this cloud just dissolve as it drifts away. But not easy, won't happen in a day. To crack this practice takes practice, but once adequately trained in this tactic, we can reduce the frequency and intensity of our anger and practice what we mentioned to be its opposite, namely tolerance and patience. Plus understand this method works just the same with other negative emotions like arrogance and jealousy. Flip them to the more positive contraries, that is appreciation and humility. Then watch how this translates to resiliency. And as effective as this is in preventing burnout, still 2 further techniques to learn about to complete our routine of emotional hygiene. Intimidated? Just trust the rhyme scheme.
The MO of the AIMI. Heard the SOS from some stressed gals and guys. HCW heroes, feeling burnt out. MDs, EMTs, RNs, no doubt. Dr. Barry Curzon heeded the call. Formed the Altruism and Medicine Institute, y'all, to prevent said burnout by building resilience, by unlocking the compassion already within us.
Well, let's recap before the third verse unfolds. Reducing burnout in healthcare workers, the goal. Building resilience, the best way to accomplish this. Behind resilience, compassion at times blocked in us. To unblock it, first observe our negative emotions, then reverse them to the more positive counterparts. In other words, emotional hygiene, that's the first part. And now let's keep it moving to the second step, namely cultivating a healthy sense of self-confidence without putting anybody down, either yourself or others around. And finally, step 3, moving beyond empathy to compassion, because essentially empathy is being in the other person's shoes, where we take on too much and thus have too much to lose, which can lead to that dreaded burnout again. Instead, let's turn to a role friend, compassion, which helps us emotionally take a half step back. Heart still open, but we no longer overwhelmed by the intensity. And there, in a nutshell, the 3 elements of emotional hygiene to help us clean up shop internally so we don't drop. We're faced with great stress like healthcare professionals are on the daily. Need to help these exceptional individuals we rely on so greatly. The Altruism and Medicine Institute taking the lead. Unblocking compassion to foster resilience. Now you've got the tools. What will you build with them?
Check the MO of the AIMI. Heard the SOS from some stressed gals and guys. HCW heroes, feeling burnt out. MDs, EMTs, RNs, no doubt. Dr. Barry Curzon heeded the call. Formed the Ultra Altruism and medicine institutes y'all to prevent said burnout by building resilience by unblocking the compassion already within us.
Compassion.